please. Please encourage the faculties.
So good evening. So I'll just stick on to time. The message is very clear. We all just want something more than just repair for the tendon to heal well. So we saw the pitch patch, we saw the bio-negative implant. We married these two, we get the BioBrace. Yeah. So we'll see quickly about. This has already been talked about. The consensus is from 2020. Most of us want something extra. So a BioBrace is like the same indication like Nilesh has already given us. This is a 55-year-old female, exactly the same case like Dr. Nilesh's, but this is the politician's wife. So he's a homemaker. She does yoga. She she had a fall 3 months back. All conservative measures failed. She has got a little bit of calcification and a little bit of chafing on the greater tuberosity. Has got all the signs of rotator cuff possible. Wants to go back to yoga, and she's wealthy. So when you see the MRI, you see a grade 2 to 3 patties, and the exact same thing that Dr. Nilesh has showed us with a little bit of subscap there. So the options that we have are everything that we can do, something more. Yeah. So I chose to do the transversus repair with the BioBrace in this patient because of want of biology. You see a torn and subluxed biceps. I let go of the biceps, and then I put the tack suture on the subscapularis and put the subscap on back to the lesser tuberosity. So I put this because we have to be thoroughly sure that we take the basics right and always make sure that all the other things are done. Don't leave anything to the patch. So the patch is only an additional procedure. So that's the subscap done thoroughly, and then go on back to the subacromial space. You have to actually do a good subacromial decompression here, because after the BioBrace goes inside, it imbibes water and fluid, and it expands in diameter. It's 3 to 5 millimeter in diameter. It goes up to 8 millimeter. Takes up to 180 percentage of more fluid inside it. That's the beauty of the BioBrace. Now the transosseous tunnel is done. You get 4 sutures out of the transosseous tunnel medially, and then take 4 bites. The medial bite I let it for the BioBrace. So this is as good as the suture anchor technique, the transosseous technique, but as better as the transosseous equivalent. So that's the first anchor, the first transosseous tunnel with 4 bites inside, retrieved it anteriorly, and then comes the second tunnel. Second tunnel is little viral and posterior. We have to cover the whole of the footprint. So that's the first one. This is the second one for the pilot hole. The exact same thing. Take the bites all over the cuff, and then once the bites are taken, you do the thorough transosseous repair. Total of 8 bites. You leave the central 2 bites or 4 bites for the BioBrace transportation. This is a thoroughly done transosseous repair. Good footprint cover without tension. So this is more than enough for most of our patients. But if the patient wants something extra and you want something extra, you want the enthesis to heal better, the BioBrace is a tabletop option. It doesn't have to have a storage temperature. When you take it in hand, it is a 2 by 3 centimeter thermocol-like substance with good meshwork. You cannot see the meshwork because it's coated with type 1 collagen. It is powdery. When it goes inside the saline, it becomes little pliable, and then you take those BioBrace shuttle sutures off, and then knead those BioBrace shuttle sutures through the BioBrace, and then pre-suture it on the outside, and then do a double pulley knot on the medial aspect, and then pull the lateral row, so that lateral pulley, so the BioBrace goes inside. After it gets imbibed with water, it becomes little pliable. You can use your soft tissue grasper and then push this graft slightly inside your passport cannula. So nothing really happens. It is actually as good as a strong graft. So nothing is going to happen. You just have to push that gently inside and then pull your lateral sutures. So this goes and sits on top of the repair beautifully. Like you said, it has to little overlay on the medial repair that you have done, and then pass point the lateral row. Once the fixation of the medial edge is done, then you pull on the lateral pulley, so the graft sits properly. You can spread the BioBrace with the probe, and then once that is done, so the medial row is seated with the sutures that you have pre-made already, and the lateral row is actually, you can finish it off with this, but for the want of good stability, what I did is I took both the medial row sutures and then pushed it back onto a lateral row suture. So that's the lateral row covering the entire cuff properly. So once that is done, you can see that is entirely seated well. I am now rest assured that the enthesis should supposedly heal well. So you can also use an alternative method by soaking it in blood before introducing it, because it has some effect. So this is one of the case report. That this is not my case report. This is one of the case report. This is at 3 months and 8 months MRI, and this is at 10 months post-operatively. That has a good cover. So BioBrace reinforces, it regenerates, it resorbs in 2 years, and it's a robust, compatible handling characters, and it dissolves in 2 years time, giving you good outcomes. So in conclusion, we don't have good evidence, but I think this should work. Thank you.
So we can have 2 questions, please.
Sir, one question.
Yeah.
Is it your preoperative decision or an intraoperative decision to use all these?
It is a
patches?
preoperative decision.
Or
of
is there
course.
any certain criteria you see in your MRI so that you demand that this patient needs a brace support?
That is little difficult to answer, but probably Cotillius 3, 4, 2, 3, you can start using it. Retest, definitely you can use something as a substrate for additional healing. Yeah, but it is definitely a preoperative decision, not a post.
How good these patches are when compared to a natural collagen donor like a biceps?
I've never done a biceps before, but it is robust. It feels very robust in your hand. So, and it is PLLA, it is going to absorb, and it has got good measures. You know, some progenitor cells are going to sit inside that, and you're going to get a good transfer. Yeah.
So can with this BioBrace, a partial repair is going to work? So if you are able to do a good infraspinatus repair and a partial repair for supraspinatus and try to put this BioBrace, because this puts mechanical as well as the
Yes.
bioinductive
Yes.
quality.
Yes.
Will that work?
Should work, but we do not have the studies yet, but should work. Because it is robust.
It's robust.
Yeah.
Thank you, Prakash.
Thank you.
Great talk.